Okay, good morning, everyone. This is Tuğçağ DUMLUPINAR, a former Navy Commando combat paramedic and postgrad student in space geophysics at INPE, Brazil. So I'm honored to present our research evaluating a novel hemostatic agent for hemorrhage control in lunar-simulated conditions. So conducted during the ENLIS 2024 mission at High Seas Space Analog Habitat, this study offers insight into critical challenges in space medicine for future space missions. But first, let me start quickly give you a content. Evaluation of emergency medicine for space exploration. Today we're gonna see a mechanism of injury in space, environmental changes, cardiovascular deconditioning, and external hemorrhage control in space, and its techniques and also tools. So also, and then we will see our experiment overview. We use blood blocker composition as titled its name. So, and also we will see future research directions. So, but first, let me start with AI-created video and get we all together a question to start.
The horrors in space medicine. Why are there not more people talking about how terrifying space injuries can be? The moon might be a place of wonder, but it's also a nightmare for medical emergencies. Gravity is weaker, wounds bleed differently. The tools, limited first step, controllably.
I think now you can hear. Yeah, sorry.
Why are there not more people talking about how terrifying space injuries can be? The moon might be a place of wonder, but it's also a nightmare for medical emergencies. Gravity is weaker, wounds bleed differently. The tools, limited first step, control the bleeding. Apply pressure directly on the wound, just like on Earth. But remember, blood behaves strangely with low gravity. Next, grab your gauze from the emergency kit. It's soaked in hemostatic agents caused to help stop bleeding through space. However, micro or low gravity can alter the behavior of bodily fluids, leading to changes in blood flow and clotting mechanisms, which may result in additional complications. You'll need to keep the wound covered, pressured, and sealed tight. If you've got a suture kit used in its space, precision and speed mean survival. Question for you: if you were this astronaut, how would you handle the terror of a wound injury? It's just science. It's survival horror for first aid.
Wow. None of us would want to experience this during a space mission, right? But here's a critical question for all of us. If you were this astronaut, how would you deal with a severe injury on the moon? Keep this question in mind as we navigate through the presentation. The solutions I'm about to share could determine the differences between life and mission failure. So, emergency management in space. Space is the ultimate austere environment where trauma management faces unprecedented challenges. Over the years, space exploration has tragically led to 21 fatalities, most occurring during liftoff or re-entry due to events like decompression and blunt trauma. So, but now we can say, and also it's very critical topic for bleeding with hypovolemic shock, posing the highest risk for crew life. Historically, space medicine adhered to the principle of treat first, but kills first, focusing on secure the airway and ventilation at the beginning of space journey of human. So, however, battlefield lessons have reshaped trauma care worldwide, emphasizing good medicine with good tactics. So this approach prioritizes controlling major hemorrhage, the leading preventable cause of death in combat, through the tourniquets and hemostatic agents, even before managing airway. So I am as a Navy commando and combat paramedic in my life, I applied these principles during mission, often treating life-threatening injuries under intensive operational constraints as TCCC, Tactical Combat Casualty Care. Effectiveness is now being translated beyond the battlefield from the wilderness medicine to civilian initiative like the Stop the Blade camping and ultimate into space. So with limited medical resources and evacuation options, space missions represents the most challenging environment for emergency management. And by integrating proven these techniques and evolving them for microgravity, we can significantly improve survival outcomes for astronauts. So this slide sets the stage for understanding how many experiment and innovation like blood blocker hemostatic agents are bridging these gaps and as a hemostatic bleeding control agents. So let's talk about a little bit mechanism of injury. First of all, analog insight to understand injury mechanism in space. Research have examined analog populations such as military pilots, submarines, and Navy combat divers as like SEAL commandos, such like me, and also Antarctic researchers. So these groups face remote and hazardous conditioning, offering valuable comparison to space flight or microgravity environment. However, space flight poses distinct operational risks that differ significantly from these analogs, such as absence of gravity-induced trauma seen on Earth. Second, common injuries in microgravity. Minor trauma is reality even in microgravity, of course, and data from the US space program shows injuries rates of 0.021, which is percentage of 1,000, and 15 per flight day for men and women, respectively. So abrasions and contusions are most common or often caused by stowing or handling equipment, physical exercise, or EVA activities. As third, unique risk in spaceflight. In low Earth orbit, significant blunt or penetrating injuries are more likely during dynamic states of flight, such as plunge, landing, and docking. So potential sources include micrometeorites, collisions, or crash, injuries from heavy equipment during space station construction or payload transfer. So, for example, objects in microgravity still have mass, of course, this means accelerated movement can generate substantial force leading to injuries. As for future risk in exploration missions, as a human spaceflight evolves, exploration class missions introduce new injury risks. Operational in partial gravity environments like the Moon or Mars will involve surface construction, heavy equipment transfer, and interaction with rovers, all in dynamic environments. So astronauts' vulnerability to fractures increases due to the space-induced osteoporosis, which heightens the risk of significant blood loss from the blunt or penetrating injuries. So let's see environmental challenges. We will see rescue delays as delayed trauma care, storage and supply limitations as resource constraints, and skill and communication gaps as medical training gaps, re-entry complications as evacuation challenges, and future mission challenges as we will see as physical impacts. So let's start first, delayed trauma care. In space, trauma management is far more complex than in emergency department on Earth. And astronauts exposed to hazards outside the spacecraft must first be protected from environment dangers, like micrometeors or radiation, before any resuscitation can begin as recovery. Even when an injured astronaut treats their crewmates, and removing the suit and deploying the stowed medical equipment can cause significant delays. In microgravity, simple tasks like restraining patients or supplies become logistically challenges. So, a second, resource constraints. The constraints of spacecraft design further complicated trauma management. Medical supplies like resuscitation fluids and equipment have limited shelf lives, and the storage space on board is tightly restricted, as you know. Additionally, power limitations may hinder the use of critical medical devices during emergency. So, as a third, medical training gaps. Astronaut medical training is another limitation. ISS International Space Station crew members receive only 9 hours of pre-flight medical training for first aid and CPR, with designated medical officers receiving an additional from 14 to 40 hours So this training focuses on enabling astronauts to interface effectively with ground-based flight surgeons. However, communication delays of up to 22 minutes on Mars missions could render telemedicine impractical, so leaving astronauts to rely on their limited medical knowledge. So as for evacuation challenges in low Earth orbit, an emergency evacuation using Soyuz or let's say Crew Dragon could take 3 to 4 hours to unlock and return. And however, the total time to definitive care could range from 5 to 48 hours. So during which medical interventions are constrained by cramped conditions and the need for pressure suites. So for deep space missions, evacuation may be entirely unrealistic, with moon evacuations taking 4 to 5 days and Mars missions requiring months. So these constraints necessitate self-sufficient medical capabilities on board, right? Despite physiological impacts, and re-entry forces compound the difficulty of managing injuries, let's say as a G-force during re-entry up to sometimes unexpected situation 8 to 9G in ballistic profiles. So worsen shock parameters, particularly in severe hemorrhage. Additionally, fluid shifting in microgravity mean that even in uninjured astronauts exhibit sign of hypovolemia. So a class I hemorrhage in space represents as a 15% of lost blood volume may mimic a more severe class 2 hemorrhage upon return to Earth, significantly compromising survival. And for these kind of issues, we also have look for some cardiovascular studies. So let's see. In space, where gravity vanishes, our bodies undergo dramatic change and fluid shifting upward, reducing blood volume and altering heart and vessel functions. So red blood cells decrease and the clotting mechanism weaken, complicated the body's adaptability to control bleeding. So it means space reshapes us, starting with our hearts. And let's dive into how microgravity transforms the cardiovascular system and heartless astronauts face upon returning to Earth. Let's go by watching one video.
What happens to astronauts' hearts in space? In microgravity, fluids shift toward the upper body, making the heart and blood vessels more compressed. Over time, the body may have to reduce blood volume in red blood cells. This leads to a smaller, less active heart. When astronauts return to Earth, gravity pulls blood back to the legs, causing dizziness and reduced cardiovascular capacity. Space exploration changes more than we think.
Yeah, fascinating, isn't it? The heart adapts to microgravity, but these changes come with significant trade-offs, especially during emergencies. Yeah, let's now dive into how fluid redistribution and cardiovascular changes impact astronaut health and survival. So let's start with first fluid redistribution in microgravity. In microgravity, fluid shifts toward the upper body due to the absence of gravitational forces, and this causes astronauts to lose 10 to 23% of plasma volume within 24 to 48 hours. So over the time, the body resets to a new equilibrium with reduced plasma and electrolyte levels, resulting in hypovolemia. This significantly impairs the ability to manage trauma-related blood loss, as the cardiovascular system's baroreflex and chronotropic responses are blunted. So secondly, cardiac and muscular change. And space flight also induced cardiac atrophy, with astronauts losing up to 12% of heart muscle mass, and within 10 days. So reduced systemic vascular resistance in microgravity decreases the heart's workload, but it's also limits the body's ability to respond to hypotension. So these changes amplify the effect of blood loss, so making trauma management more challenges. So for figure, we can see as first, pre-flight on Earth, 1G, then space mission, early flight, and late flight in microgravity, let's say 0G, but micro. Return to Earth again in 1G gravity. So upon entering the microgravity environment, fluids shift toward the upper body, as we said. So upon return to the Earth, the normal redistribution of blood volume results in low central blood volume, reduced hematocrit, and overall reduced cardiovascular capacity to deal with normal gravity conditions. So anemia, spaceflight anemia. Anemia weakens the clotting system efficiency, increasing the risk of prolonged bleeding and complicating hemorrhage control, particularly in challenging environments like space. So spaceflight anemia further compounds these issues with the red blood cell mass decreasing by 11% on long missions. Nearly half of astronauts develop anemic hemoglobin level after just 21 days, reducing their oxygen carrying capacity. So these conditions worsens on exploration class missions due to the space radiation, prolonged exposure to microgravity. So combined with fluid shifts and the cardiovascular deconditioning and anemia heightens the risk of under controlled bleeding in space environment. Also, for this slide, if you can ask, if you want to ask a question after the presentation, it will be possible or dive further. So, as for hemostasis challenges, hemostasis in space complicated by reduced platelet function, systemic vasodilation from elevated carbon dioxide levels, and impaired coagulation mechanism. So venous bleeding exacerbated by the lack of venous wall compression is another challenge observed in parabolic flights. So combined, these factors make achieving hemostasis in space far more difficult compared to Earth, right? Has 5 critical impacts. So given these physiological changes, the golden hour for trauma intervention, the critical period when treatment is most effective, becomes significantly shorter in space. So underscores the importance of rapid and effective hemorrhage control. And our research using blood blocker hemostatic agent directly addresses this need, as it was tested under space mission condition to provide critical bleeding control. So hemorrhage control, space and current assistance tools. We're gonna start with MARCH protocol. Let's start with the MARCH protocol, which is the backbone of the modern trauma care. This systematic framework addresses critical injuries in the following order, as acronym of its. So massive hemorrhage, airway respiration as ordered by their importance, respiration, circulation, hypothermia, and head injury. So why does MARCH prioritize massive hemorrhage first? Because it is the leading cause of preventable death in trauma situation. A landmark battlefield study from 2001 to 2011 revealed that 91% of preventable deaths were due to massive bleeding, just a massive bleeding. And yeah, preventable deaths were due to massive bleeding. This statistics is staggering. It means that without immediate intervention, survival is nearly impossible. So these battlefield realities shape tactical combat casualty care, as called TCCC, such like the MARCH protocol. But as someone who has lived the reality of these statistics, and I can tell you this is not a theory. So this is a practice I have carried out under intensive operational constraints. So as a combat medic, I have witnessed firsthand how hemorrhage control can make the difference between life and death. So this picture is from my time in the field as a war paramedic, where quick decisions under pressure were often the decision control, and this is me. So now consider how this applies to space. In space, just like on the battlefield, evacuation and advanced medical care delayed, right? And sometimes by hours or even days. So space missions, however, had unique complications, fluid shifts due to microgravity, limited resources, and the lack of resupply chain. So immediate intervention is not just a critical, it is mandatory. So the brilliance of MARCH protocol lies in its simplicity. So it starts with massive hemorrhage, as we said, because no other convention matters if the patient is losing blood uncontrollably. So by controlling bleeding first, an astronaut can stabilize the other injuries and buy precious time, the other, precious time to address airway, respiration, circulation, or hypothermia concerns. So these are tools for life-threatening hemorrhage control. Let's see for first tourniquet. Tourniquets are life-saving tools, of course, and a cornerstone of TCCC, and they allow rapid control of limb hemorrhage, buying time for advanced interventions. However, prolonged use, especially in space, poses risk like ischemia and compartment syndrome. And the combat applications tourniquet, now part of the ISS medical, must be reassessed or converted within 2 to 6 hours to minimize complications. So as a maximum, we can use on Earth 6 hours, but we didn't try before in space on orbit. Addition of combat application tourniquets, Gen 7 to ISS medical kit is a step forward. So crew members undergo brief familiarization training during their pre-flight preparation. So however, even with this training, any in-flight use requires the ground consultation, highlighting the need for more autonomous solutions. And current TCCC hemostatic dressings of choice. So when it comes to external hemorrhage control, combat gas, quick load is the go-to choice in both military and civilian trauma care. It's been proven effective in stabilizing bleeding, let's say 79 to 89% of penetrating injuries, with even higher success rates in civilian trauma. However, in certain situations, especially when bleeding sites are not amenable to tourniquet use, Celox and Shitogas provide valuable alternatives, could be. So these Shitosan-based dressing create a mucoadhesive barrier that aids in bleeding control without relying on the body's natural coagulation system. Okay, they have been found be safer and more effective than combat gauze in preclinical traits. And effectiveness in terrestrial settings, these hemostatic agents have been instrumental on Earth, showing significant improvement in survival rates. And a study reviewing over 2,700 cases found that using combat gas, Celox or Shitogas improves survival by an average of 70%. While combat gas relies on natural clothing, its effectiveness is somewhat limited in space environment due to the altered coagulation system in microgravity. So let's talk about challenges in space. Yeah, in space, the dynamics of bleeding are complicated by microgravity. So for instance, combat gas reliance on the body's clotting mechanism might be less effective in space, where astronauts experience altered coagulation. And moreover, powders and granular agents are impractical in microgravity. Imagine trying to pour a granule powder into a wound in a weightless environment. It will float away before reaching the wound site. So this is our concerns. So other hand, Celox and Shitogas, however, are more effective, as we said, but in these settings because they work independently of clothing system, making them better studied for space missions. But they have still with a 10% of failure, even if on Earth, rate 10% failure rate to stop or minimize bleeding using Shitogas in civilian settings. So in addition, the hemostatic dressing tools like X-Stat and IT clamp are essential for external hemorrhage control bleeding hemorrhage in space. So X-Stat, for example, uses rapidly expansive sponge coated with Shitosan to seal deep, narrow tract wounds, which are common in junctional injuries, like those in the groin or armpit. So its compact design makes it ideal for space mission. Yeah, the IT clamps is another promising device. It's self-locking mechanical clip that applies pressure to a wound, generating a hematomia to tamponate bleeding. While both X-Stat and IT clamp are useful on Earth, their efficiency and safety in microgravity need further evaluation. These devices offer a low-weight, low-volume solution for space mission crucial in a resource-constrained environment. So until now, we have discussed various hemostatic dressing like combat gas, Cerox, and Shitogas, which are valuable tools for hemorrhage control in terrestrial settings. While these products have proven effective in many cases, they also come with inherent failure rates, as we said, particularly in an environment like space maybe. So it's also where coagulation is altered and microgravity complicates the application of powders and granule agents. And so now this is why we have selected blood blocker for our experiment, the HELSLC lunar space simulation. So blood blocker is unique formulation, makes it a game changer for space missions. Unlike traditional dressing, blood blocker works independently of the body natural clothing system, offering more consistent and reliable results in non-cauterizing trauma situation. With its synthetic, synthetic mixture, and also radiation-resistant composition, compact design, and long shelf life, blood blocker is uniquely suited for the challenges of space, making it superior option for deep space mission where traditional hemostatic agents may fail to provide the necessary support. So this product represents the future of space medicine and could be a crucial tool for astronauts' safety on mission on the Moon, Mars, and beyond. So blood blocker surpasses traditional agents by working independently of the body's natural clothing system. Its synthetic formulation and robust performance in extreme environments make it uniquely suited for deep space missions. Unlike traditional powders or gauze, which can fail in microgravity, as we said, blood blocker is fast, reliable, and effective in the most challenging conditions. So each ingredient in blood blocker serves critical purpose. For instance, calcium is vital for clotting process, while selenium aids tissues repair. This precise combination makes blood blocker effective even in complex ones in unique conditions like microgravity, as you can see in details. So blood blocker is not just fast, it's versatile. Its antibacterial also properties and compatibility with patients and anticoagulants make it universal solution for hemorrhage control. And importantly, its sterile composition accelerates wound healing without causing pain or further damage or without wound cautioning or burning cells. So blood blocker, the mechanism of action, the protein network. Blood blocker creates a robust protein network bypassing the need for traditional clotting cascades. So this makes it effective in patients with clotting disorders or those exposed to microgravity where natural coagulation is impaired. So usage. Blood blocker wipes are designed for simplicity and speed. With 3 steps process, they allow even non-medical personnel control bleeding effectively in emergency. Such like the other traditional guns, the same technique, but offering more efficiency, less than 3 minutes. Blood blocker offering less than 3 minutes. This is what we also did in our experiment, we will see. So blood blockers versatile makes it indispensable for both medical professionals and astronauts. So its ability to control bleeding in diverse scenarios, including arterial injuries and extreme conditions like hypothermia, sets it apart as a breakthrough in trauma care. So now let's jump to our groundbreaking exploration of space medicine, hemostatic agent performance evaluation under the lunar-simulated conditions. So the mission MES 2024 at HELSLC, the Hawaii Space Exploration Analog Simulation, brought together experts and cutting-edge technologies to tackle the unique challenges of lunar missions. So our primary focus, our experiment evaluated the blood blocker hemostatic agents' performance in controlling massive hemorrhage, a top priority under the March protocol. As we saw, this mission exemplifies the intersection of innovation, science, and exploration. So space exploration demands tools that are adaptable as environments we seek to conquer. So our experiment not only tested blood blockers' efficiency, also as a spin of space technology, but also pushed the boundaries of what is possible in extreme resource scarce environments. So by simulating the lunar conditions, we ensured that our findings will directly inform protocols for future missions to the moon and beyond. And this research bridged the gap between innovation and application, showcasing how science can safeguard human life in the hardest conditions. So the success of our experiment relied on environmental fidelity by controlling, of course, parameters such as the temperature, pressure, and carbon dioxide levels. We ensured that our findings directly applied to lunar missions. These settings tested blood blockers' adaptability to extreme conditions, providing the critical data for its interaction into the astronaut medical kits. So the protocol was meticulously designed to evaluate both immediate and adaptive responses to blood blocker. By day 6, results demonstrate significant improvement in clotting time to reflect both physiological adaptation and the agent's unmatched efficiency, unsurprisingly. So the results exceeded expectations. Blood blockers not only achieved rapid clotting, but also improved the performance with the time reaching a record-breaking 43 seconds clotting time by day 6. So this underscores its potential as critical tool in space missions, where time-sensitive interventions can mean the difference between life and death. So the two phases protocol allowed us to explore both immediate and long-term responses to blood blocker. So testing after 6 days revealed an impressive 30% of improvement in clotting times, underscoring its potential for sustained use during prolonged missions. This comprehensive evaluation demonstrates the productivity's ability to adapt to evolving conditions, making it game-changing for space medicine. So implications. Blood blockers' success in experiment paves the way for its integration into the EVA protocols, enabling astronauts to manage injuries in real time without needing immediate Earth-based support as much as telemedicine, or its fast action, ease of use, and adaptability make it an indispensable asset for lunar and Martian missions. So our research opens new frontiers by extending testing for Martian conditions and developing advanced training modules. We aim to equip astronauts with the tools they need to thrive on long-duration missions, as we said. So you can see also under the microscope image, like here and also here. So in conclusion, our experiment validated blood blockers' potential as a transformative tool in space medicine. By combining innovative science with real-world applications, we have taken significant step toward ensuring the safety of astronauts as humanity ventures further into the cosmos. Blood blockers is not just a product, it's a promising, of course, as we saw, for a safer future in space exploration. And looking forward to ongoing advancement and approach emerging from the battlefield suggests that tactical and surgical combat casualty care will continue to provide valuable lessons in the years to come, and can help to further improve hemorrhage control and trauma care for future space exploration as blood blockers. Okay, thank you so much.